Good morning and good afternoon, everyone, from wherever you are in the world. Welcome to the live question and answer session regarding the wonderful short presentation that you've heard. Now, my name is Atul Singhal. It's my real pleasure to be your chair for this session. And we already have many questions, so I will start straight away and I'll ask each of the participants that you've heard just a few minutes ago to deal with some of the most important questions that we're dealing with. So these aren't going to be all the questions, but the most popular questions that you put forward. So I'm going to kick off by asking Maureen the first question. This is, without economic development, how can we improve nutritional status by nutritional education alone?
Hey, thank you very much for that question. Let me see, if we're interested in promoting economic development or contributing to it, then it starts really very early. So it starts with ensuring the nutrition of mothers and fathers prior to conception. And, you know, when we think about promoting healthy nutrition, we focus on the food that's available. We also focus on the feeding habits, the eating habits that are available. And so we try to take advantage of the resources that are there. So we say with children, it starts prior to conception and then continues through the prenatal period and then early in life through breastfeeding, which one can look at what the economic aspects are of breastfeeding, and they certainly are there. And then into the toddler period that we have focused on. So that's time to help children develop healthy habits around the foods that are available. There are resources to try and use, find local foods that are of limited cost. And those are the kinds of things that we promote in our children. It's also the time of building healthy habits, so that as children continue to grow, that they have healthy foods during meals and are not wooed by junk food or unhealthy foods. Starting early on, then as those children grow, it contributes to their ability to learn, and ultimately that contributes to their ability to earn and contribute to human capital, and there's an improvement in economic development. So thank you.
Thank you very much. So the next question is addressed to me, and there's two questions very similar, so I'm going to deal with both of these at the same time. The question is, does high protein consumption in toddlerhood have an effect in metabolic programming predisposing to obesity, just as it happens in infancy? And the second related question is, are there differences regarding the type of milk or protein versus other animal milk on metabolic programming? Well, the answer to both those questions in a short nutshell is yes. The amount of protein that a toddler gets is very strongly correlated with the risk of obesity later in life. And we think this is related to the promotion of faster weight gain in toddlerhood, which subsequently programs for an increased risk of obesity. And there's about a 30 observational study. The problem is, unlike in infancy, we don't have any randomized controlled trial data in the toddler age group. But I had a feeling that that sort of data is difficult to get. So the second part of the question is, does the type of protein make any difference? Well, we don't know the answer to that, but the higher the level of protein, the faster the weight gain in infancy or in toddler years, and the higher risk of developing later obesity. So we have some evidence that the amount cow's milk, and particularly cow's milk, has faster growth promoting effects, possibly via stimulation via GF1. So those questions are extremely relevant. Okay, so the next question is addressed to Mauro. Regarding the use of fad diets. The use of fad diets, such as low carb, gluten-free, are increasingly amongst toddlers. What are the possible consequences of these diets? Mauro, could you answer that one for us?
Oh, thank you very much for the question. It's a very interesting one. I think children are going in very restrictive diets, especially they are restricting fruit, vegetables, legumes, and especially some of them are restricting milk, some of them are restricting cow's food. And so it's important to see which kind of group foods are they restricting it? Why are they restricting it? It's based on philosophy, it's based on religion, it's based on trend, it's based on the education of the fathers. But we usually know that the positive habits of restricting some of the foods that we are eating, especially cow's meat, could be different if they are decreasing a lot of foods like dairy food, or they are restricting sources for vitamins and minerals, and especially for iron, zinc, copper, and other things. So it depends very much on which kind of restriction and which kind of diet are they having, for how long, and especially which will be the approach that we have. If their parents are vegetarian or they are vegan, we have to cope with that. And so we have to orientate them in order to try to reduce the consequence of these preferences, and not based on the fact that is a modism or something that is only a trend. So it's very different from case to case, and the consequence of that will be different for the timing of the restriction, and which will be the amount of restriction, and which kind of food groups they are restricting.
Thank you. That's lovely. So one question for you, Alison. Thanks for your nice presentation. That's great. Is there iron deficiency also common in high-income countries, and more common than actually thought previously?
Well, there is a range of iron intakes across different countries, that's for sure. And so we do see, even in countries that are well nourished overall, iron deficiency in a smaller percentage of children. So it's very important, especially during the complementary feeding period, for children to get iron fortified infant cereals or other sources of iron in their diet. The particular paper that was mentioned in this question by Vandermeer found that 3/4 of young children across Europe were iron replete, meaning they had enough iron. But we did see in that paper very big ranges from quite low iron deficiency to quite high iron deficiency in Eastern Europe countries. And so I think this really underscores one of my points from the presentation, that having dietary intake data from individual countries gives you a perspective that you wouldn't be able to otherwise find. Thank you.
Thank you. I know, I completely agree. I think it's very important. One of the key messages is that it's not poor nutrition in toddlers isn't something that's confined to low-income countries, and I think it's a really common problem in high-income countries as well. So I've got a question for Mauro. What are the nutritional deficiencies common in obese children?
That's very important because, as we know, obese children, they are not gourmet children. So they eat a lot, but only things that they want. And usually they have a very restrictive patterns, especially from fruit, vegetable, legumes. And usually they do eat a lot of sugars, they had a lot of fat, and they had a lot of occasions of meals. So they have many deficiencies that could occur that we call the obese hidden hunger. And this is very important in many countries because they are obese, but also they have deficiencies of some minerals, vitamins, and they have some difficulties in just increasing this amount of vitamins and minerals because they do like their kind of food, and usually they are not very eager to accept new ones. So the obese children, they do have problems if they restrict milk, if they restrict fruit and vegetables. They probably sometimes they have some restriction on the preparations and the type of preparations that they have. So we know that they are very selective, and based on the selectivity, they are picky eaters. So they have to be treated as the most extreme picky eaters, like exactly other kinds of things. So they have a lot of possible deficiencies. And one of them linked to the other question that we have, one of the problems that we are having in our country is the anemia in obese children, especially in those who are not eating meat. So we have a lot of problems that we have to take care when we are discussing obesity in children.
Absolutely, and I think this highlights the so-called double burden. You get overnutrition and undernutrition in the same populations, and in fact in the same children. So I think it's a very important question. Now, I've got a question for Maureen, which I think if you know the answer to this, you'll make many mums happy around the world, because it's a question that many mums actually face. Is developing healthy eating habits in children sometimes a challenge. So how do you convert a junk food eater into a homemade food eater? And I think that's a really difficult question.
Oh yes, I think if we can answer that question, I mean, that would make many people, many people happy. Let's see. You know, if we think, how do children learn and what guides children eating, is that they learn by their context. They learn by what they see, and what they see others doing, and by what's available. So if we're thinking about toddlers, there are not many toddlers who are actually going to the store and buying food. Now, are there? No, there aren't. So who is the one who is going to the store and buying the food? It's not the toddler. I tell our patients that who have children who are either growing not enough or growing too much, that at this point in life, the parent is bigger than the toddler and smarter than the toddler. But every day,
Not always.
the toddler is gaining on them. Every single day, the toddler's getting bigger, getting smarter, getting bigger, getting smarter. So you have to move into action now. And as long as the toddler's not the one going to the store, the parent is. And kids do what they see their parents doing. So starting earlier helps. So if you want your child to have healthy food, what should you be eating? What should you be serving? You should be serving healthy food. And if you want your kid to eat chips, then provide the chips. So it's a strategy, and it's not picking on the child that this is the special food for you, which is only veggies, while the rest of us are having cookies or chips or whatever, but it's food for the family. And that's what we're having. And that extends to other behaviors of children as well. But all over the world, many parents are afraid to be parents. And we say, would you let your child play in the street? Of course not. So you help your child develop a healthy habit by you having a healthy habit and by having a routine of healthy habits. And believe me, it often works.
Absolutely. I think one of the things I learned from your talk is how much they mimic, and how much they mimic in terms of what they eat. It's just quite remarkable, isn't it, really? Okay, now in the absence of Prof. Prentice, could I ask Alison to, perhaps she might be able to address this, but somebody else could interrupt. In Bangladesh, many of the babies of working mothers are cared for by others. They dislike food given by others. Is this food phobia, or is this something else? This is either Alison or Maureen can try and answer that one.
Maureen, do you want to take a stab at this one?
If they dislike food that's given by someone else, sometimes what happens is that they're whether they are feeling uncomfortable because it's a different context, and so children are very, very smart. I showed you pictures of children imitating at the second day of life. They're very smart, and they can detect when there are differences, and they learn how to manipulate their parents. And one of the strongest ways that they can manipulate their parents is by not eating. It is powerful, extremely powerful. And that will cause parents or cause caregivers to do something else. And the something else that they do is often not very adaptive, in that if a child isn't eating, then sometimes a parent or a caregiver will give them something that they think they will like, and that turns out to be a sugary substance or an unhealthy substance. So whether that is going on, that's possible, but children love routine. We all like routine. So if a child is not liking something, then I would go back to the modeling, that you eat it, you do it, and you continue it in a routine.
Great, thank you. I'm going to choose a nice, easy question for myself. There's Just appeared. It says, is it recommended to take cow's milk before the age of 2? And that's a very important question, but it's relatively straightforward because we have a lot of policies around this question. So most nutrition groups such as ESPGHAN, SEICAN and so on say that we should not have any cow's milk under the age of 1, partly because it's got too much protein, but more importantly, it's very low in iron and it causes microscopic blood loss from the gut. So it's associated with iron deficiency. So that's relatively straightforward under the age of 1. Between 1 and 2, there's also a recommendation now from many bodies, the Canadian Dietetics, the ESPGHAN and so on, that we should reduce the amount of cow's milk intake. I know the ESPGHAN guidelines, for example, are about 500 mils, no more than 500 mils a day, partly because it's associated with obesity. So that is a relatively easy answer. Okay, now this is one I don't think anybody will know the answer to, but somebody wants to have a stab at this. During the pandemic, should all toddlers get vitamin D and zinc? Anybody want to have a go at that one? Or
yeah, I can start, I think. I think at the beginning of the pandemic, I think the majority of the researchers in the world, and especially the population, tried to search something in the nutrient area that could prevent or could at least reduce the effects of the corona and other things like this. And after a lot of experience and a lot of things, we have seen that we have to be very careful on that. Immunity is something, and nutritional offenses are totally different. So we know that we have to be at the top of your defense in order to prevent or at least combat the infection, but we do not have any potential magic nutrient that could help or could enhance your defenses during this episode. Yeah. So the other thing that we have to understand is that we are confusing some things. We are at home, we are not getting the children out of the home, so the environment will be reduced in light, so the majority of them, probably they had a reduction of some kind of fishes, and probably they had a reduction of sun. So the probability of having a high deficiency of vitamin D is probably very important. And also we had a confusion on zinc. Zinc was related to the hyporexia or the modifications of taste or the modifications of smelling, and is also related to zinc deficiency. But we have not seen many differences on the supplementation of zinc in these patients. So we have to be very careful on the specific role of one of the nutrients inside one difficult situation for everyone.
Yeah, I completely agree. I think it's very easy to look for solutions like vitamin D or zinc or whatever the magic bullet is, but we need the data and we need to do the proper studies to actually support that. So completely agree. So there's lots and lots of questions on weaning. So I'm going to ask Maureen just to, I'll try and answer some of these. During baby-led weaning, is there any specific rules such as start slow with minimal type of food, texture, etc.? And I know it's a very fashionable area, baby-led weaning. So could you?
Yeah, it is very, very fashionable and popular, as I noted, in some in some settings. So what is a major concern in baby-led weaning? And that's one of choking. So clearly that you would give a child something that they will not choke on. The other thing is there are indicators as to when a child might be ready to do that. And we know that children don't have a, oh, there's Andrew.
Yeah, Andrew is coming.
we know that children don't have a pincer grasp until around 11 or 12 months. So they're using what's called a rake grasp to pick things up. So you give them something that, that they can pick up themselves, and people sometimes will use little pieces of softened, like banana, or softened meaning steamed soft kind of veggies that they use. What the recommendations often are is it's a piece of something in the family meal, but it should be that they can pick it up, that they can get it in their mouth, and that they're not going to choke. There are many other considerations in the book. We've included references around baby-led weaning. So useful to consult the published references that are there.
Thank you very much. I see Andrew's with us, and you've got the best setting in the background. It looks like a beautiful day wherever you are. So I'm going to ask a nice question for you first. The question is any relationship between geographic variation and stunting? That's from Bangladesh. So what's the sort of differences around the world? I think they're trying to ask. You're mute.
Hi, everybody. So sorry I dropped off, connection problem at this end. Any relationship between, well, obviously there is, but it's not really geographic. It's more related to, I suppose, you know, the sort of tropical temperate zone tends to be an area where bugs propagate very well. And so what I pointed out in my talk is that it's not just about food and nutrition, it's about all the other, what we call nutrition sensitive elements that factor into that as well. And including hygiene, I talked about the wash interventions. So it is difficult to keep bugs down in tropical settings. It also tends to be those tropical settings that are poorer. So the point I really made was that it's really about economic development. Everybody, I think, in the world aspires to keep their children in a clean and healthy condition, but many people don't have the wherewithal to do that because they're too poor. And once countries come through that economic transition, even without, you know, a ton of specific interventions or education, everything seems to improve because parents have the wherewithal to do better for their children.
Sure, thank you. That's a perfect response. There's a couple of questions on probiotics and obesity, so I think I'll take this. The question is, what is the role of some nutritional supplementations and probiotics in the prevention of obesity in children? Now, this is a really, really fashionable area, very trendy, lots and lots of publications in this area. My problem has always been, there's been a lot of associative studies with probiotics, particularly in infancy, and later risk of obesity. These have all been associations, but actually just presented a few days ago, the European Society of Endocrinology was the first, as far as I know, RCT in 100 patients, 100 children, they're roughly 6 to 8 years of age, I think, where they gave both groups one group a probiotic, the one group a low calorie diet. They both got low calorie diets, and the group that had probiotics had a lower, they lost more weight, so they actually improved better. Now that's a very small 100 patient RCT. I think there's something in this. There's lots of animal evidence that supports this, but we're not there yet in terms of a causal link between probiotics and obesity. But again, a very, very important and topical area. So now I need to find a question for Alison. So,
how about red meat consumption?
yes. Please answer that. Do you want to read it? Because I don't.
Okay. The question is, red meat consumption in adults is associated with heart disease. Any data on meat intake in toddlerhood? Well, we've looked at toddler consumption patterns around the world, and we actually see quite a lot of different patterns of intake. Certainly there are countries where meat intake is very, very rare for one reason or another. Either it's culturally inappropriate for them to consume meat, or that they just don't have the money to consume meat. And in other countries where meat is available, it often tends to be consumed, not red meat, but say chicken, for example, in the United States is more popular than red meat. So what we really need to do with toddlers is understand the context of the consumption in their own country, and then look for opportunities to provide the iron that they need, either through fortified products or through increasing intake of meat sources or other sources that would provide iron in their diets.
Absolutely, thank you. Okay, do you want to answer another question while you're on a roll here? So, is it necessary to start vitamin D supplementation from birth? Would you be able to answer that?
Well, I'm not a medical doctor, so I feel a little out of my element with that question.
Okay. The answer is in most countries, in most parts of the world, they recommend vitamin D supplementation for birth because despite the hot climates and sun exposure in places like India, vitamin D deficiency is extremely common during pregnancy in women of childbearing age because they have no sun exposure despite the high sunshine. So most countries recommend vitamin D supplementation at birth, especially in the breastfeeders. And the formula feeders, you tend to get enough vitamin D in the supplementation, but certainly in the UK, we recommend it for both. Okay. Yes.
I think it's important to see that in our country, in many countries in South America, the supplementation of vitamin A and vitamin D from birth age is very important. So it was a very, very old measure that it was implemented many years ago. And beside all the facts, we know that we have decreased the very important amount of rickets in our countries. So I think it is very important, even if you are not having increased the amount of breast milk or for formula supplementation. But I think the supplementation from vitamin A and D from the birth age was very important to decrease rickets in our countries.
Absolutely, completely agree. So this is definitely a question for Alison. It's food diversity. I noted 8 food groups instead of 7. Oh, somebody's moved my question. That's gone. Okay.
Oh, it was the diet diversity question?
Yes, that's
well,
right.
There are, both the USAID and UNICEF have slightly different lists of foods that would go into the diet diversity score. So I just gave an illustration that used 8 food groups, and breast milk was listed as a separate food group because most recommendations would be for breastfeeding, and we would all agree with this. Breast is best for babies, and so they have breast milk as a separate category, and other milks, other dairy products as a different category as children get older to ensure diet diversity. So they're not incongruent with one another.
Thank you. This is my favorite question. It just says, excellent, Dr. Maureen. There's no other question. So I'm going to answer this. No, Dr. Andrew, here you go. You believe that there are unexpected results from the WASH project. What do they have to do with the hypothesis of the microbiome?
So the WASH results, as I indicated, were extremely disappointing to all of us. Of course, very much so for the funding body, the Bill and Melinda Gates Foundation, and for the investigators. It's important to say these were fantastic trials, done really, really well. So we don't need to redo them. We know this is the answer. Now, I think the problem was that they simply weren't intensive enough. So these children are living in such an unhygienic environment that the level of intervention needs to be much greater than was achieved in those trials. So where this is going now with the World Health Organization and the investigators in those initial trials is to come up with what we're calling transformative WASH, which is the understanding that we've really got to do much more. And my take on this is that what you really need to do is to pipe water into people's homes. That, to me, is the critical variation. It's been shown that even if you have to only go 20 meters or so to a tap, you use 20 liters per day per person in a household. If you pipe it into the home, you use 60 liters per day. And so there's a vast difference in water usage, and we would infer that that then hygiene, and that then comes around to this vicious cycle of gut damage and why children don't grow well.
Thank you. So Mauro, I've got this question. Considering the high prevalence of nutritional deficiencies in Brazilian toddlers, do you think that specific milks for any age could have a beneficial role?
Oh, besides having a very high increase of breastfeeding in our country, we have not reached the necessary amount that was recommended by the core organizations. And we are still promoting the using of whole cow milk in the first year of life. I think we are one of the last countries in the world who are using it without, and especially it is recommended in some guidelines. So I think it's very important for us to try to combat this kind of approach. And based on fact that we have a lot of deficiencies, especially from vitamins A, D, C, and other vitamins and minerals also, I think the possibility of having a modified milk or an infant formula for at least 1 or 2 years of age after the weaning, I think it's very important. It's a way of combating our deficiencies, and especially because based on the fact that many of our products that are not fortified as they are used in other countries, like juices and milk and other products. So I think it could be very important to have a modified milk, at least for the follow-up continuation of the first year of life.
Excellent, thank you. So I'm just going to deal very briefly with the next question. Is stunting can reduce IQ? What about obesity? The problem is it obesity or is it the micronutrient deficiencies associated with obesity? So there is some observational evidence that obese children have slightly lower IQs, but again, it's impossible to tell which particular nutrients are important. Obese children, as we discussed earlier, have lots and lots of malnutrition and undernutrition in many different things. So there's lots of questions of weaning. Obviously, this is
may I jump in? Perhaps it was phrased clumsily, the question, but it's very important to stress that stunting does not cause IQ.
Right.
Stunting
I hope so.
I hope so. With poor IQ. It's because I'm taller than some others doesn't mean I'm smart by any means at all. They're associations only.
Yeah.
Or that I'm shorter than others.
Yeah.
You know, no.
Yes,
so please,
I have.
It is stunting does not cause IQ.
Absolutely, and there's that's a common problem in nutrition. We assume association and causal, and we always fall down on this. Okay, so Maureen, what foods were given as first foods in those practicing baby-led weaning?
Thank you. I to some extent answered that question, that the first foods that are given are ones that are soft, that do not cause choking, that the baby can pick up in her hand using a rake grasp, because at that point she does not have a pincer grasp yet. So a rake grasp, and that she can get to her mouth. And it's often the foods that the family is eating, but softened. Baby-led weaning takes place with a child seated so that the child can see the family can see the child. So you're taking advantage of the modeling and the imitation that happens, and it's part of a family meal rather than a separate occasion.
Sure. The most popular question, I've been avoiding it, but I'm going to have to deal with it, is does high protein diet in formula milks affect kidney function in infants? And the answer is yes. So one of the reasons that cow's milk is dangerous for babies, it has too high osmolar load, it affects kidney function, it causes dehydration. And in fact, formula milks were developed to be safer, better than cow's milk. Present formulas, they don't have that same problem. They have much lower osmotic load, and so they don't have that issue. So just deal with that one very quickly. Okay, there's this one, I think Andrew might be the best person to answer this, is can improving mother's nutrition during pregnancy help with the problem of childhood obesity? You talked a little bit about maternal size and nutrition affecting stunting, but any thoughts on obesity?
Yeah, so there's two aspects to that question. Again, I indicated in my talk, we're intensely interested in not so much the nutrition of a mother during pregnancy, but the nutrition of a mother before she conceives.
Sure.
And I think there we can give some very simple answers and some very complicated ones. Obviously, I won't give the very complicated ones now, except to give an indication that they're there. The very simple one is that a mum should really try not to be overweight when she conceives. If she can possibly get down to at least somewhere near to a reasonably ideal body weight, then the baby is going to fare better. So that's an easy statement to make. There are of course both genetic, as you pointed out, and familial associations between obesity in the mums, in the dads as well, and later life. So it's very hard to pick out whether changing the nutritional intake and status of a mother in pregnancy would be effective. Various trials have been undertaken with the primary outcome of trying to look at birth outcome. Are there fewer premature babies, etc. Those have been universally quite difficult to implement in a high income setting because mums aren't terribly good at losing weight or eating less during pregnancy. And then there have been attempts to follow up.
So anybody want to talk about lipids? I think lipids are important in nutritional development.
Lipids are critical for the development of toddler brains and other organs in the body, and so we have specific nutritional requirements for lipids for that, absolutely for that reason. So I think that we wouldn't want to encourage a low-fat diet in toddlers at all, because they need the fats, especially the omega-3 fatty acids, for brain development.
I completely agree. It's one of these confusing things. Low fats may be better in adults, but they're not for toddlers. It's quite. I'm afraid we've got lots and lots of other questions. They keep coming up on my deck here, but we've had our half an hour, so I hope we've given you some sort of flavour of why toddler nutrition is very important and some of the sort of key public health and clinical issues that are important. So I'm just going to ask Natalia to say a few words to wrap up this session. I think this is the first of 3 sessions, so I hope you've enjoyed the talks and the questions. And Natalia, can you say a few words for us? Thank you.
Okay, thank you very much, Atul. What a wonderful session. Great presentations, but discussions and questions are just absolutely fantastic. Thank you very much for everyone, for you, dear faculty, and for you participants for asking these great questions. Before I come for the small summary, I would like to really ensure you that all questions which we were not able to answer today will be answered later by our faculty, and we will place that recording on the National Nutrition Institute website. So coming back to the session today, we were talking about nutrition challenges in young children and toddlers. We had grade 5 presentations where we discovered what are the developmental milestones in toddlerhood. And it seems it's not that easy to become a great toddler, because you have to go through a lot of steps of growth and physical development and learning and cognition and develop your eating behavior. And that's what Maureen explained at her presentation. While Alison moved us to the nutritional intake, and if you look around the world for those countries which have a dietary survey, it's very clear that around 50%, maybe even more, toddlers, they don't get adequate intake of macro and micronutrients. And that's for different reasons, for reasons of maybe unavailability, but sometimes it's just for reasons of not enough education and understanding of importance certain nutrients. And definitely the surveys which have to be done in majority of the countries, they can help us to identify the gap and also to make improvement in the nutrition of toddlers and young children. After that, Mauro brought us to Brazil with the beautiful nature, but also with a lot of challenges in young children and toddlerhood. And he explained to us that situation is not that easy in Brazil because there are still some cultural habits which are maybe not very favorable for nutrition in toddlers. And Mauro showed us a survey, the latest survey in Brazil, and it's definitely, there is a lot has to be done to make sure that we make a great establishment and foundation for the young children to make them a great adults in the future. With Andrew and following Atul's presentation, we took 2 different parts of growth and actually malnutrition. While Andrew was talking about the nutrition faltering, and he explained us that sometimes, especially in the countries which have a challenging nutritional and economical background, young children, they're coming to the toddlerhood already with a lot of establishment in the form of wasting and stunting. And this is very important to know, because the right nutrition have to start even before pregnancy and preconception and continues during the all first 1,000 days. And it should not stop with the first year of a child life. It should continue, because toddlerhood, coming back to Maureen's presentation, gives really a lot of developmental milestones. And Atul explained us the situation with overweight and obesity. Atul, usually you talk about the infancy, how the protein, and that's why you had all these questions, how protein can program and what is right and wrong in the period of infancy. But in your presentation, you greatly showed us that the toddlerhood is also not a period where we can relax as a parent or as a healthcare professionals. We can relax and not to thinking anymore about the right nutrition. In the past decades, nutrition of toddlers became very different. Some nutrients they eat more, like carbohydrates and fat. Some nutrients and foods like fruits, vegetables, and fibers in that they eat much less. And of course, portion size, physical activity, and all programs. And what I like, and in Atul's presentation, it actually, he gave us the main idea of all this session, that early nutrition is not just the tool to provide right nutrients. It's much beyond. It's forming the child, it's forming the adult with all its health benefits, but also with all behavioral and social and emotional status. So with this, again, I would like to thank all of you. And you, dear participants, you come tomorrow at 2 o'clock Central European Time, 9 o'clock in the morning in Brazil, for the next session with Maureen Black about how nutrition can shape our future. Thank you very much and see you tomorrow.
Thank you.
Thank you, everyone.
Thank you. Bye-bye. Thank you.